Hello and welcome to our page. My name is Tanya LeGrand and I am an insurance broker in Schuyler, Nebraska. We want to do some educational videos and just kind of get you up to date with plan options when you join Medicare. So we're going to begin a little presentation here for you. I call it my Medicare 101. And we're going to go through some slides. And if you could, just to participate in this, get out a piece of paper and a pen, because we're going to do a little pop quiz as we go through this presentation, and just kind of want to test your knowledge and see what you know, and hopefully the objective is for you to learn something here today as you go through this presentation. To know a little bit about us, again, I'm Tanya LeGrand and I have an agency in Schuyler, Nebraska. Our mission is to educate our clients and serve them by providing options that best meet their needs. We represent a carefully selected group of reputable insurance companies. As independent agents, we establish a relationship between our clients and the insurance company that best fulfills their individual needs. We offer our clients a team that is dedicated to service and value. Maintaining the highest ethical standards and credibility with our clients, carriers, and the public is extremely important to us. Our clients can be rest assured that we are looking out for their best interests. Our promise is to take the time to educate you about your options, as we are convinced that knowledge is key to making decisions that bring you peace of mind. Here is our team. Again, I'm Tanya LeGrand. Dorothy Davenport, who is actually my mother, she's a licensed agent as well. She works primarily in Medicare with me, and she joined our office not too long ago, so it's pretty exciting to watch her grow and learn more and more, and actually take her years of experience from working at a hospital and now applying it to helping people find credible coverage for them. Carrie Butsky is an agent that we work with as well. She does primarily our group AFLAC and individual AFLAC as well. So she's our AFLAC representative at our office. Adi Hernandez is our office support manager. She is here full time, and we're very thankful for her. And then we have Deanna Garcia, and she's our office support staff as well. She keeps us busy. She schedules appointments and takes care of our applications and taking care of our customers' needs. So that is our team here at our office. So if you call our office, these are the people you may be speaking to when you call. I believe there are three things that set us apart that I want to share with you as we go through this time together. Number one, we educate. Our promise is to take the time to educate you about your options, as we are convinced that knowledge is key to making decisions that bring you peace of mind. I am a firm believer that if you are not aware or understand your options when it comes to your insurance coverage, that there's no peace of mind. We value and we respect the fact that you trust us, but we want to make sure that when we are working with you, you understand what your options are so that you do have that peace of mind, and you are rest assured that you have what you need to have to take care of yourself and to take care of the financial risk that's involved in getting insurance. So like I mentioned earlier, we're going to want you to have a pen and paper. We're going to do a Medicare pop quiz. We just want to test and see what you know, and hopefully our goal is to make sure you learn something here today. The first question, number one. Medicare is a health insurance for which of the following? And you can choose as many that apply. So I'm going to give you some time here to decide. Is it A, anyone who wants it? B, people age 65 and older? C, people under age 65 with certain disabilities? D, people of any age with end-stage renal disease? And like I mentioned, there's more than one answer to this question. Hopefully you've had some thought, and let's find out the answer to question number one on this Medicare pop quiz. The answers are B, C, and D. People age 65 and older, people under age 65 with certain disabilities, and people of any age with end-stage renal disease. All right, here we go with number two. Question number two. Which part of Medicare covers the following? Is it Part A or Medicare Part B? And that would be inpatient care in a hospital, skilled nursing facility care, hospice care, and home health care. Which part of Medicare covers those services? Hopefully by number 2 you have written down an answer, and that answer would be Part A of Medicare. Part A covers your inpatient hospital care, your skilled nursing facility care, hospice care, and home health care. Question number 3. How much does Part A of Medicare cost per month? How much does Part A of Medicare cost per month? What is the cost of Medicare Part A? And the answer to that is going to be here right next, and that is premium free. As long as you have been working and paying in, you should not have to pay a premium for Medicare Part A. It should be premium free. Okay, question number 4. What is Part A of Medicare's deductible? Now this is kind of a tricky one. We got a $ per blank day benefit period. So I'm going to give you a little time here. What is Part A of Medicare's deductible? And we're going to get the answer right next. And it's $1,288 per 60-day benefit period. Now that is confusing to a lot of people that I talk to. And this is if you just had your red, white, and blue card, you had nothing else with it, just your red, white, and blue Medicare card. If you went in the hospital in the month of January and you had to go in because you broke a bone or you fractured your hip or something, you're in the hospital, you are going to be responsible for the first $1,288. That is your responsibility for being inpatient. Now, if you go in again, let's say in July of the same year, because you're past that 60-day benefit period, you again will be responsible for that $1,288. Most people look at a deductible and think, hey, that's just the one time of year. But in this situation, it actually can occur more than once a year. So again, the answer right there is $1,288 per 60-day benefit period. And that deductible does change yearly. So that's something you want to stay up on and know what your responsibility would be with just your red, white, and blue Medicare card. Question number 5. Which part of Medicare covers the following? Again, is it Part A or is it Part B of Medicare? Services from doctors or other healthcare providers, outpatient care, durable medical equipment, and home health care. Is that covered under Part A or Part B? And that would be all those services there. And the answer is going to be Part B. We already covered Part A, which is inpatient hospital. Now we're looking at Part B, and that's going to be services from doctors and other healthcare providers. And the following services: the outpatient care, durable medical equipment, and home health care. Question number 6. How much does Part B of Medicare cost per month? Now there is a cost to Medicare Part B per month. And that cost is $121.80. Now that is the amount for the year 2016. That number changes every year as well. So the 2016 Part B of Medicare premium is $121.80 per month. If you are receiving Social Security benefits, that amount will come out of your Social Security check. So you'll notice that right in your Social Security check, the $121.80 to pay for your Part B of Medicare. However, if you are not receiving Social Security benefits, then you would be responsible to pay that quarterly to Social Security. All right, here we go with number 7. Number 7, what is Part B of Medicare's deductible? We talked about Part A. What is Part B of Medicare's deductible? It's $, then blank per blank. We're going to cover that next. And the answer is the Part B of Medicare's deductible is $166 per year. Now the Part A is per 60-day benefit period, but the Part B is actually $166 per year. So this actually is a little bit more understandable when we're looking at deductibles and how it applies. Like I mentioned before, the A is a little confusing, but the Part B is $166 per year. All right, here we go with question number 8. Are the following covered under Medicare Parts A and B? And the answer is going to be yes or no. And what we're looking at is most dental care, eye exams related to prescribing glasses, dentures, cosmetic surgery, acupuncture, hearing aids and exams for fitting them, long-term care. What we're asking is, are these services covered under Medicare Parts A and B? The answer to that is no. Those services are not covered under Medicare Parts A and B. Now, when people are leaving group insurance, the question I get asked a lot is, does that cover my dental and does that cover my vision? And the answer is no. That is not a covered service under Medicare. So you're going to want to look at supplemental coverage to cover those services. Okay, question number 9. When can you change your Medicare supplement plans? When are you able to change your Medicare supplement plans? I'm going to give you a second to write that down. Do you have an answer? Here we go. The answer is anytime. You can actually change your Medicare supplement plan anytime. Now, when I do these seminars, a lot of times people say, well, isn't it October 15th or December 7th? That's the time. That is a Medicare time. However, with your Medicare supplements, you can change those at any time throughout the year. Everyone gets their annual increase at certain different times. And so when you get an increase or you're looking at saving money, we can actually change your Medicare supplement at any time throughout the year. But there is a catch, and that's going to be the next question here. As long as you blank qualify. You can change your Medicare supplement anytime as long as you blank qualify. And the answer there is as long as you health qualify. And we come across situations a lot. That's why we're insurance brokers. So when people come to us and they go, gosh, my Medicare supplement premium just has really increased lately and now I'm paying this much. Well, we want to do our best to help save you money. And so we're going to go ahead and shop those plans for you and see what we can do to make it better and not lose the benefits you currently have. And so we're able to shop different carriers in a case by chance you're treating a condition that maybe one carrier won't take you on, but another carrier will. So there are health questions that are related to qualifying for a Medicare supplement. And we're happy to work with our clients to see and to find the right plan for them to help save them that money. How did you do? Do you feel like you did pretty good? Maybe you're out there and you're going, hey, I answered every single one correctly. Or some of you might be saying, I really didn't know the answers to that. I guess I never really thought of it. And we're at all areas of the spectrum here. We all come in different places, but it just kind of makes you aware of what you know and what you don't know. And that's why we're here to do these educational things so we can teach you. We're going to talk about how to sign up for your benefits with Medicare. It can happen automatically. If you're already receiving benefits from Social Security, you're automatically going to be enrolled. If you're automatically enrolled, you'll get your red, white, and blue card in the mail 3 months before your 65th birthday or your 25th month of disability benefits. You may need to sign up. If you're not receiving benefits from Social Security, then you're going to need to sign up for your coverage. So I have, if you're close to age 65, but not getting Social Security or railroad retirement benefits and want Part A only or both Parts A and B, you will need to call Social Security at 1-800-772-1213 or go online and sign up for your Medicare benefits. Today we're going to talk about Medicare supplements, and I have the grid here of the Medicare supplements that are available. You're going to see letters A through N on your screen right now, and there's some letters missing. But today we're primarily going to focus on plans F, G, and N. Those are the plans we're going to focus on today. The good thing about these Medicare supplements is you're able to see right here what they have for coverage and, the check marks here that are available and kind of the boxes that are not checked. The nice thing is all the plans are standardized. So it does not matter the carrier you have. If you have a Plan F, which whatever carrier you are under, those benefits are the same. Even if your friend has a plan with a different company, the same Plan F, the benefits are identical. They do not change based on carrier. The plans are standardized. So here we go with Plan F Medicare Supplement. We're going to talk about the Plan F first and kind of break it down so you understand if you do have a Medicare Supplement Plan F, what your responsibility is with that plan if you were to see the doctor or go in the hospital. So the first question that we're going to bring up here is doctor's visit. If you have Medicare alone, how much are you going to pay for your doctor's visit if you had Medicare alone? And the answer is you're going to pay up to $166 for the deductible and 20% coinsurance. So if you have Medicare alone, the red, white, and blue card with no supplemental, then you are responsible for the Part B deductible, which is $166 per year, not per 60 days. That would be Part A. But the $166 is per year. And then with your Part B, there's a 20% coinsurance, meaning that anything above the $166, you are responsible to pay 20% of those charges that Medicare approves and allows. If you had the red, white, and blue card plus a Plan F Medicare supplement, if you go to the doctor's office and you have a visit there and Medicare approves those charges, you're going to pay nothing. So it's like, okay, I got my Plan F, I got my red, white, and blue card, I go to the doctor. If Medicare approves those charges, you're going to walk out of that office paying nothing. It's zero to you. You don't have to worry about the deductible, and you do not have to worry about the 20% coinsurance. Okay, if you were inpatient hospital and you had your red, white, and blue card alone, again, no supplemental, your red, white, and blue card alone, what is your responsibility if you were inpatient? And the answer to that is that $1,288. That's your responsibility if you're inpatient in the hospital. And again, that's a 60-day benefit period. If you have the Plan F Medicare supplement with that red, white, and blue card, you will pay nothing. As long as those services are Medicare approved, you should pay nothing at that hospital with your Medicare supplement. From anything that Medicare approves, your supplement will come and pick up the remaining balance. Medicare allowed physical therapy. Okay, physical therapy is something that is common, in with most folks who are on Medicare. So if you had Medicare alone and you needed physical therapy, you would pay $166 if you had not met that yet. It's an annual deductible. And again, that number changes. That's for 2016. It's $166. And then you would pay 20% of all allowed charges. So I really don't know how much you're going to pay. I can tell you right now, though, it's going to be 20%. And whatever that adds up to, that's what your out-of-pocket's going to be if you have Medicare alone. But if we get the Medicare Supplement Plan F and you have Medicare approved physical therapy, you should pay nothing. Again, it's that kind of peace of mind going, all right, I prepaid my health care. I got my Plan F. I pay my premium every month. I know if I go to the doctor, I'm going in the hospital, or I have to have physical therapy or some type of therapy that Medicare approves, it's that peace of mind of knowing I'm not going to have to pay anything. And that is where people feel, it's kind of that relief going, I don't have to worry. I don't have to worry about this. So we're going to talk about Plan G next, okay? Now, this is another Medicare supplement that is really common. A lot of people are interested in knowing more about the Plan G. And so we're going to break that down next, okay? So again, we're going to go over the same services we just talked about. A doctor's visit. We know right now with Medicare alone, you're responsible for the $166 deductible and then the 20% coinsurance. With Plan G, you're responsible for the $166 for the Medicare deductible. So the difference between the G and the F, we just talked about the F, and I said if you went to the doctor, you would pay nothing. But with the G plan, the thing that is different is that you are responsible for the Medicare Part B deductible. That's the only difference between the G and the F as far as benefits. It's the only difference. So you do responsible pay that $166 before it's going to kick in and cover, that 20% coinsurance and the remaining charges after. So that would be your financial responsibility on the Plan G, would be the $166 for the deductible. If you go in the hospital, that's $1,288. You are responsible for the Plan G to pay nothing. Again, it's that peace of mind going, okay, if I'm inpatient, I can walk out paying nothing as long as Medicare covers that service. Physical therapy, like we talked about earlier, the Medicare alone, it's $166 deductible plus the 20% allowed charges. Plan G, you would pay the $166 if that deductible has not yet been met. Now, if you've already paid that $166, then you would pay nothing, kind of like the Plan F. But you gotta pay that first $166 on the Plan G. That's really the only difference here between the G and the F as far as those benefits. Plan N. That's the next one we're going to compare. Now we're going to look at all of them together. Okay, if you can see here, I have it together so we can look at the Medicare alone, the Plan F, the Plan G, and the Plan N. Okay, so if you go to the doctor, we know Medicare alone, like we've talked about, you pay the first $166 and then 20% coinsurance. Plan F, you pay nothing. Plan G, you're going to pay the $166 deductible. What does Plan N look like if you had a supplement Plan N? You're going to pay $166 for the deductible. And then if you notice, and if you look right in your Medicare New Handbook, it says specifically co-payment up to $20 for some office visits and up to $50 co-payment for emergency room visits that don't result in inpatient admission. So the difference here is if you have that Plan N Medicare supplement, you are responsible for that deductible, Part B, much like the G there, but then you're responsible for a co-payment every time you go to the doctor, and that's going to be that $20. So there's a co-payment every time you go to the doctor with the Plan N, whereas with the Plan G, you just got that deductible to pay. Plan F, you should walk away paying nothing. Okay, so there is a difference kind of between these three plans. That's interesting, and it's nice to see it right next to each other just to kind of compare apples to apples and see what is the difference between these three plans that are most common typically around, especially here, for people who are looking at getting Medicare coverage, getting that supplemental coverage. Inpatient hospital. We know with Medicare alone, we got that $1,288 every 60-day benefit period. Plan F, Plan G, you both pay nothing, and Plan N, you pay nothing. That is a covered benefit under your Medicare supplement, which is good to know because honestly, being in the hospital can definitely add up. So that's a nice benefit there with all those plans. That is a covered benefit. Medicare allowed physical therapy. We know there's that deductible with Plan G. And Plan F, you pay nothing. Plan N, you got that deductible to pay when you go for physical therapy. Okay? So that is part of your benefits with those three plans. The supplement Plan F, the supplement Plan G, and the supplement Plan N. I like to compare them right beside each other because it makes it easy to understand, your benefits with these types of plans. So that's what we just talked about, are the supplement plans F, G, and N Medicare supplements. Again, we're going to talk about the things that I believe truly set our office apart. I mentioned before that we educate. Second thing we do is we save you money. We are insurance brokers, which means we are contracted with several insurance carriers to find plans that meet your needs. We take pride in the fact that we take care of our clients and find them cost-effective plans. We shop the carriers to save you money. And so, like I had mentioned earlier, the Medicare supplements are standardized. I showed you just earlier the plan specifics benefits, with a few services, the Plan F, the Plan G, and the Plan N. But doesn't matter the name on those cards, those benefits are the same no matter who your insurance carrier is. And so I tell my clients typically, about every 3 years, we're going to look at seeing if we can save you money because the truth of the matter is, every year your premium is going to go up. It is. You're going to get increases. Some clients call me and they go, by golly, my carrier raised me 2 times in a year. And then I bring them, they come into my office, I get to meet them, I get to help them, and I'm excited because I love it when people come in and we're able to say, you know what, we're going to save you $50 a month. That's $600 a year. Is that going to help you? And they're going, oh my goodness, this is a great thing because it's hard to live on Social Security. Sometimes, period. It's just hard to make ends meet. And so we always want to be of service to our people and help them save money and shop the plans for them and make sure they're where they need to be. We shop the Medicare supplement plan premiums. That's what we do. And I love what I have here. I love this visual. And this is how I do view it. Like I mentioned, those plans are standardized. You know, if you are driving down the street and you see gas on one side, like in this illustration that I have, you see gas on one side, you see the regular being $2.50 a gallon. You look across the street, it's $3.17 a gallon. I think I know where you're going to go. I know where I'm going to go. If I know I'm going to save money on gas, I'm going to go where it's going to be cheaper. And that's a lot like how I look at the Medicare supplements, because they are standardized. The benefits don't change with the plan types by the insurance carrier name. So if we can help and save that money, we're going to do it. And we're going to show you. I put as our slogan long ago, I said, you know, we have options. And I love that. And that's what I always want to have in our business is we want to have options for our clients. We want to be able to say, here's what we have, and now you get to make the choice. And that's nice to know. It's nice to know that we're not just telling you what to do. We're going to show you, and we're going to show you exactly what's available to you. And it's that peace of mind of knowing, wow, someone's looking out for me. I always want to make sure we have options for our clients, and so that they know that we're taking care of them. Our top 3 reasons: we educate, we save you money, and we provide service. To me, that is key above all things. We can teach you something, but if we're not available to you, if we're not helping you, it means nothing. We want to provide service. We establish a relationship between our clients and the insurance carrier that fulfills their individual needs. Our office has support staff who are fluent in both English and Spanish to help you with questions regarding your coverage. We do yearly reviews to educate you about your options. Most plans change on an annual basis. I never want to be, and this is so key for our office, I never want to be where my clients would say, well, someone wrote me a Medicare supplement, but I don't remember who they are, but this is what I have for my coverage. That would be a disservice. And I don't ever want that reputation. So every year, our staff, we reach out to all of our clients and we make sure we communicate with them and we do a review to have that peace of mind to make sure that they are exactly where they need to be. And so when they come in for any changes that they're making, they know that we're out looking for them. We're taking care of them. We're taking the time to educate them and to show them what is available to them. To me, annual reviews are huge. And it's just that way of saying, we're here for you, and we want to make sure we're doing our best to take care of you. That's key, in my opinion. And that's how I want my office to always reflect to our clients and to the community and the people that we serve. That's first and foremost, in my opinion, and that's the most valuable thing we can do. So I'm Tanya LeGrand. My office is located here in Schuyler, Nebraska, and we have clients from a variety of places, and we look forward to meeting you. We look forward to helping you, and we look forward to educating you. I do have a website, and that's www.tanyalegrand.com, and I do have a phone number at our office, which is 402-352-6610. I hope this has educated you. I hope this has given you time to kind of get an idea of who we are. And this is just kind of a real basic, Medicare educational tool that we have out there. But we do other tools as well to help people, to get them educated in different lines that we work with as well. But we just want to take the time to educate you, for you to get to know us and to know who we are and what we're able to do to help people. If you have any questions, give us a call. We'd be happy to hear from you. We'd be happy to help you. And we want to thank you for listening to us. Thank you for clicking on this link and getting yourself educated about Medicare. Whether you're retiring right now and you're looking into going, I don't know what to do. I don't even know how Medicare works. And this has been a little tool to get you there. Or whether you've been on Medicare a long time and you took that test, that pop quiz, and you thought, oh my goodness, I don't know anything. And now you're going, wow, I feel like I learned something, and maybe I am paying a little more than I need to on my Medicare supplement, or maybe I'm not on the plan I think I should be on. No matter where you are, we're happy to help you. Feel free to give us a call, and we'll be happy to be of service to you and become friends, because that's the key thing. We want to be friends with our clients, and we want to be able to establish that relationship. So again, I thank you for your time. I hope you have a great day, and we'll talk to you soon. Take care.